Okay, this is Dr. Ayub, and today I will continue on the two cycle, ovulatory cycle or ovarian cycle and the menstrual cycle. Okay, so two cycles, one is ovarian cycle and menstrual cycle. Okay, let's give the idea that what is the goal and objectives and what is our expectation. Sonographically, we need to learn this two cycle, because a lot of patient will come with a problem in the menstrual cycle and problem with the ovarian cycle in regard to the ovulation, and they are suffering from infertility. Some patient will come with pain in the pelvis. Some patient will come with the bleeding through the vagina. Some patient will come with both pain and bleeding. Some patient will come too much bleeding. Some patient will come irregular bleeding, maybe more than one period in one cycle. And every patient we ask, when was your first day of your last menstruation? First day of your last menstruation, we call it LMP, last menstrual period start. Why do I need to know this? Why? Because the menstrual cycle and the ovarian cycle, both of them are influenced by the hormones, and there are some common hormones that works both on the uterus and the ovaries. And one cycle accompany the other cycle. So that's why if one cycle has problem, the other cycle should have problem. And the hormonal imbalance, it also work on both cycles, and both cycles can be irregular, imbalanced. Then what is our expectation? Our expectation that to understand that what are the phases of each cycle and what are the hormones work on each cycle and what are the sonographic appearance of the uterus and the ovary in each cycle, each segments of the cycle. Why do I need to care about the sonographic appearance? Yes, we need to care because there are some changes happens with the phase of the cycles, and I want to see that changes in ultrasonography in order to understand the cycles are normal, in order to understand that organs are working normal. That's why we call it physiology. It is discussed in the physiology. Functions of the ovary, functions of the uterus, functions of the ovary. So this is one of the major function, the production of the mature egg, production of the hormones that influence on the uterus, and keeping the post-ovulatory corpus luteum inside the ovary that produce the progesterone that is needed to protect, support and make it alive the fertilized, that is the fertilized egg, that is the implanted fetus in the uterus. They need progesterone, and the corpus luteum will persist 10 to 12 weeks in the first trimester to supply the progesterone to keep the baby support, protection and making it alive. Keep that in mind. This corpus luteum is in the ovary, in the post-ovulatory phase. If there is a fertilization and the embryo is formed, but in the ovary you don't see the corpus luteum, it is vanished. So do you think that pregnancy will sustain? No, it's not going to sustain. It will be miscarriage. Okay? So our expectation without pregnancy and with pregnancy, we like to see some changes in both uterus and the ovary to understand everything is going normal. Okay? So now let's talk about the ovarian cycle. Ovarian cycle that happens to the ovary. The ovary, we know the ovary is almond shaped, oval shaped, and the ovary has cortex. The outer layer is the cortex, and this cortex has primary follicles. And how many primary follicles are there? Maybe 50,000. Okay? So in the cortex, there are primary follicles. Sometimes we can see when it is little enlarged, and most of the time we don't see. And you will see in one cycle the multiple primary follicles are growing, but one of them will turn into Graafian follicle or mature follicle or adult follicle. Okay? So inside this area is known as medulla. Medulla. Okay? So medulla is inside, cortex is outside. And cortex contains the primary follicle. And the medulla is a support infrastructure of the ovary. And the ovary has its capsule. As the way the testis has tunica albuginea, here the ovary is surrounded by a capsule. Okay? And fibroelastic capsule, connective tissue, and it is hyperechoic. And this ovary produces the egg, number one. and the egg will be released from the ovary. And ovary is also produce hormones. Estrogen, progesterone is in the ovary. So ovary, like a testis, this is called gonad, are the dual function, endocrine and exocrine. So exocrine part is, you can consider, is the formation of the follicles, primary to Graafian follicle, and endogenous production of hormones, estrogen and progesterone. Okay, so now these functions are guided by the three phases. What are those phases? Number one, pre-ovulatory phase. Then ovulatory phase, and number three, post-ovulatory. Post-ovulatory phase. Pre-ovulatory phase means before the ovulation. Before the ovulation. And ovulation takes place on 14th day plus minus 2 of menstrual cycle. 14th day of menstrual cycle. Just keep that in mind, because later I'm going to draw a chart to make you easy to understand. Pre-ovulatory phase is day 1 to 14. Okay, it could be plus minus 2. And ovulatory phase, that is, mostly it is 14th, but it can occur 12 to 16 days. Okay, in ovulatory phase. And the post-ovulatory is from 15 days to 28 plus minus 2, because mostly it is 4-week cycle up to 28 days, and 15 to 28 of that period, this is day, and it can vary 2 days early and 2 days late. Okay, and now what are the hormones work in the pre-ovulatory phase, and what happened in pre-ovulatory phase? Pre-ovulatory phase, primary follicle turned into Graafian follicle. Graafian follicle means mature follicle. Okay, and with the influence of follicle stimulating hormone, that follicle stimulating hormone comes from pituitary gland. Okay, so it comes from pituitary gland. By the name follicle stimulating hormone, that means it stimulates the primary follicle into secondary follicle, which is Graafian follicle. And during the pre-ovulatory phase, there is an increase of estrogen. Okay, there is a estrogen production, and the highest level of estrogen reach on the day of ovulation. Estrogen must touch the peak. There is a cutoff point, and it touches the peak, and the LH, luteinizing hormone, LH, is produced by the pituitary. Okay, and ovulation takes place. So now, ovulation phase. In the ovulation phase, the estrogen reached at its peak. At its peak, and luteinizing hormone LH, luteinizing hormone comes from pituitary gland. Okay, now if luteinizing hormone fail to be released, ovulation will not take place. And the major cause of non-reaching its peak is failure of estrogen peak. If the estrogen level is non-linear fashion, it's not linear rise, and it touches the cutoff point. If it does not happen, then pituitary will not understand that it is a time to release the LH. The LH will not be released, and ovulation will not be happen. We call it an ovulation, an ovulation period. Okay, so and that is one of the cause of infertility. Okay, and now that is ovulatory phase. And post-ovulatory phase, in the post-ovulatory phase, there is you will see there is a corpus luteum, there is a production of corpus luteum, and the corpus luteum will produce the progesterone, and corpus luteum persist 10 to 12 weeks if pregnancy takes place. But if pregnancy does not take place, so by 2 weeks from the production of corpus luteum, by 2 weeks it will be vanished. Okay? Because non-pregnancy corpus luteum and corpus luteum with pregnancy is a look different. And finally, when a corpus luteum is vanished, it will turn into corpus luteum albicans, means whitish dot inside the ovary. Okay, and if it is a non-pregnancy, then corpus luteum will disappear very quickly before the onset of next cycle, that is by 2 weeks. Usually it is not unseen in the ovary. But when there is a pregnancy takes place, then it will persist 10 to 12 weeks. Okay, so this is post-ovulatory, the production of corpus luteum. So corpus luteum is actually the Graafian follicle when it releases the egg. That means ovulation takes place. The leftover of the follicle inside the ovary is known as corpus luteum. Okay, so now I am drawing the ovary again with the corpus luteum. Okay, this is the capsule, and understand that so this is primary follicle, and primary follicle is getting bigger, then finally it turns into more bigger, and it is with the stimulation of follicle stimulating hormone. So follicle stimulating hormone. So this is primary, and this is Graafian. Okay, and the ovum is inside here. And during the ovulation time, there will be leaking or breach of surface. Okay, and this ovum will be released. This ovum will be released, and as soon as it is released, then this membrane will healed automatically, and nothing is coming out. So this is known as, this is released ovum. So now this ovum is not inside. So now what happened? So this will turn into corpus luteum, and in this corpus luteum, then you will see anechoic. You will see the fluid. You will see the fluid, and it is the blood and tissue fluid, and it is known as corpus luteum hemorrhagicum because the bleeding inside. And I found that this corpus luteum, usually the wall is thickened and it looks very prominent. Sometimes it is bigger than the Graafian follicle, and it is hypervascular around it. Why? Because it is alive, active. It is producing progesterone. Okay, so this is corpus luteum, CL, corpus luteum. And this corpus luteum will remain prominent if pregnancy